Welcome to our cellulitis webinar. We do a introduction to the webinar, just the way it's going to structure. The panel, introduce you to the panel as well. And then what is cellulitis, signs and symptoms of cellulitis, and then we'll be able to answer some questions for you. The LASA committee is very excited to be able to put on our first webinar for this year on cellulitis. So it's a warm welcome to you all, guests, and tonight's panel, and obviously the LASA community, or committee, sorry, I should say. As I was saying before, we'll do an introduction to the panel and guests, introduction to cellulitis and the signs and symptoms of cellulitis. We'll introduce the panel and the guests and enable them to share their experiences. And then we'll have the questions and answers. Now, at this point, we have a few questions that have been sent in previously to us, and we'll work through those questions and then open it up as well to all you members that are in the webinar for further questioning. Now, guests for tonight, no particular order. Our first one up is Sharon Tilley. She's the principal therapist at the Lymphoedema Laser Clinic over at Stepley. Many of you would have known Sharon from treatments as well. Now, a little bit of history about Sharon. Now, with Sharon and the Flinders University clinic undertook inaugural research investigating the effects of photobiomodulation, or low-level laser therapy, on breast cancer-related lymphedema back in 1995. In 1989, while working as a senior physiotherapist at the outpatient department at Royal Darwin Hospital, she began using the PBM in the area of hand rehabilitation and wound management. Since 2000, she has been the principal therapist and working with 5 physiotherapists in the area of post-cancer rehabilitation, and has 11 lasers now, and varying models range from class 1 to 3B in her clinic. Sharon has been published in the UK Journal of Lymphoedema and has presented for and held committee positions with the Australian Physiotherapy Association, the Australasian Lymphology Association, or ALA, and the Australian Medical Photobiomodulation Association. It's taken me a little while to get my tongue around that one. She's presented workshops on the use of laser in lymphedema management at several ALA and AMPA conferences, the World Association of Laser Therapy Conference in Washington, DC, and teaching facilities in Hong Kong. So very experienced. Jan Douglas is a lymphedema therapist, person affected, and a researcher in the area of lymphedema. Her postdoctoral work was in low-income countries where she has implemented an enhanced self-care protocol for people affected by lymphatic filariasis and podocynosis, I'm not sure if that's right pronunciation there, related lymphedema. Now, Jan has a strong interest in self-care and the central role it can play in the prevention of secondary infections. Now, we will go through a fair bit of self-care tonight as well, and questions around that. Oh, sorry, I missed you there, Jennifer. Jennifer Ritossa is a clinical advisor in lymphology at SCT. Is that right?
That is right.
Formerly BSN Medical. Background in physiotherapy. She provides fantastic support for the lymphedema therapists in compression garment selection and measuring to achieve, obviously, the optimal results for her patients and our patients. Always on hand for advice. So thank you, Jennifer. Now, myself, lymphedema therapist, oncology massage therapist, remedial massage therapist, personal trainer. And the last little bit here is I was a lecturer at TAFE SA, but I just finished 2 weeks ago. So I should take that off. But I've been lecturing with them for 8 to 9 years now. I'm also passionate about promoting self-care and exercise in the management of lymphedema, and hope to share some of that knowledge with you tonight. I've been on the lymphedema committee, LASA committee, since October last year, 2021. We also have with us tonight Jean, Karen, and Ashley, who have all experienced cellulitis and have graciously donated their time, if you like, to share their experience and their knowledge around the cellulitis as well. So obviously get a patient perspective from it. All right, so the next few slides, we're just going to sort of run through what is cellulitis, and then just some of the signs and symptoms, and then we'll sort of open up a little bit for our guests to sort of talk about their understanding of cellulitis, how it occurred for them, and also their signs and symptoms. Okay, so cellulitis presents with an acute spreading inflammation of the skin and subcutaneous tissue characterized by pain, swelling, warmth, and erythema or redness. It may be associated with lymphadenopathy, fever, and systemic toxicity. If the rash progresses, blistering of the skin may also occur. Now that's sort of a medical description of it. The cellulitis in the lymphedema affected area may be varied in presentation and may differ from classical cellulitis. The causative bacterium of cellulitis in lymphedema is almost always Streptococcus pyogenes. Cellulitis is a common potential, this is just another description. Cellulitis is a common, potentially serious bacterial skin infection and is usually caused when a break in the skin allows bacteria to enter and cause an infection. Now, the break in the skin can be a cut, ulcer, insect bite, dry, cracked skin, as an example or examples. The affected area is swollen and inflamed and is typically painful and warm to the touch. Cellulitis usually affects the lower legs, but can occur anywhere on the body, face, arms, and other areas. Now, if cellulitis is left untreated, an infection can spread through the lymph nodes and bloodstream and can rapidly become life-threatening. Cellulitis is not contagious and rarely affects more than one area of the body at the same time. Oh, sorry. Cellulitis and some of the signs and symptoms. Near irritated area of the skin that tends to expand, swelling, tenderness, pain, warmth, skin color changes, fatigue, spots, blistering, skin splotchy or mottled. And then we've just got a few photos of various examples of cellulitis. They tend to be mostly leg ones we've got, legs and feet. But the signs and symptoms would be same anywhere on the body. Okay, that's sort of the initial part. So now what I'm going to do is just open up the discussion or the webinar to our guests for this evening, and I'm going to just go through running how I suppose their cellulitis occurred for them, some of their signs and symptoms with that as well. If it's okay with you, Jean, I'll open up to Jean initially because she's first on the list here, and you can sort of run through and give us a bit of background about yourself and your cellulitis.
Okay, thank you. I had breast cancer about 22 years ago, and then lymphedema was really not discussed at all, and I had no idea what cellulitis was. About 15 years after that, I had the prick of a thorn in my finger.
Gardening thorn?
Rose, yeah, rose thorn. And I noticed aching in my arm for a couple of weeks, but I thought I pulled a muscle or something. I didn't get a lot of swelling or redness in the beginning. So to be honest, I just ignored it for at least 4 to 6 weeks, I'd guess. Okay. Until one day I looked at my arm and it sort of swelled up like a balloon and I noticed some redness. And my daughter convinced me that I should go to the hospital and get it checked out because of course it was a Sunday. So I went to Mount Barker Hospital and at that point we had sort of locum GPs in emergency. So I saw the GP and he said, oh, you've got cellulitis. Here's a prescription for an antibiotic for 3 days. You'll be fine. And I mentioned my history with breast cancer and I asked him about lymphedema and he said, don't be ridiculous. This is just a simple infection and you'll be fine. So I went home and I took the antibiotic, and about 3 days in, I started running a fever and I was really quite ill. So I went to the GP, and I had a very good GP, who looked at my arm and said, oh, you've got lymphedema. This is cellulitis. And immediately got the nurse to wrap my arm. And then also decided to call the breast surgeon, and who ultimately sent me for a bone scan just to be absolutely sure that it wasn't a metastasized cancer in my arm, which, so I did that and it was clear. And then the GP arranged an appointment with Sharon's clinic, and also put me on a different antibiotic. So I was on antibiotics for 16 weeks. Twice, I remember they tried to remove the antibiotic, but then I would get ill and feverish and the infection would come back. During that time, I saw Sharon's clinic. I was there probably twice a week, I think, in the beginning, for both massage and laser. And that went on for, from memory, about 6 months. So it took about that long to get it sort of, the swelling to get down to a normal level where we could sort of focus on the lymphedema and not the infection. So yeah, I would say 4 to 6 months before we got the infection under control. And then it was just a matter of learning how to live with lymphedema and manage it. And I became a regular patient of Sharon's every 6 weeks for many years. And yeah, after that, I think I went into an encore program for breast cancer for 6 weeks, an exercise program. And that was just brilliant because then I could really understand how important exercise was in terms of moving the fluid. And really that was the key for me for self-management. So I did that and then went back into Pilates after that for many years. Yeah, I think that's about the gist of it.
I've just got a quick question for you. So there was no signs of lymphedema before the cellulitis that you're aware of?
Sorry, say that again?
There was no signs of lymphedema prior to the cellulitis?
No, none, no.
And that you're aware of anyway, so.
No, I mean, I wouldn't have even known. Yeah, but I mean, I was checked regularly by the, I went, gosh, every 6 months and then eventually every year to the breast surgeon for a checkup, and there was never any fluid buildup that was noticed.
Yeah, okay.
For the cellulitis.
Yeah. How long between your original diagnosis with the breast cancer and the cellulitis?
15 years. 15 years.
Oh, yeah, okay. Yeah. Okay, thank you. Thank you, Jen. Karen, are you there? Would you like to share with us?
I just had to find the mute. Hi, everyone. So my history of cellulitis happened soon after surgery. So I had a melanoma that progressed to stage 3 in my, and so like Jean, probably I had an axillary clearance. They also threw radiotherapy at me because there wasn't anything else at the time. And the healing part of that took a very, very long time. I had a drain in for almost 3 months. And then the hole that the drain was in just didn't heal up, and that took several more months to totally heal up. In that period too, I had my first experience of cellulitis. My surgeon had given me a sleeve to wear. She pretty much put me into the 25% category and said, you will need to use this from the day after surgery onwards. And I just did what I was told, and I did that. And I think the first cellulitis I had, they just called it an infection. And I was admitted into hospital and they gave me antibiotics, but nobody really explained what it meant. So that was it. I went into St Andrews, and I felt like a bit of a second cousin or a poor cousin to the breast cancer people, but I was so happy I was in their ward because I got to access the breast cancer nurses, and I would never have learned about what I might do about lymphedema if it hadn't been for them, or it would have taken me a long time. But they told me that I should probably start seeing someone about lymphedema from fairly much early on, as almost like a prophylactic treatment, because they thought with the cellulitis and everything else around it that this would probably be my progression. So I saw, I think I'd seen someone, it may have even been Sharon, so we're talking 2013, 2014 at this stage, and I turned up one day and said I really wasn't feeling very well. And I think it was a Saturday morning appointment, which was a bit odd. And I said I wasn't feeling very well. And they said, well, you've got cellulitis. And I'd never heard of it before. And so they sent me off. And so I suppose that's the first time was every single time I have had cellulitis since. And for me, it has actually been a regular visitor. I had a irritation. The only thing I can explain is it feels a little bit like the onset of a urinary tract infection. You don't know what's happening because it's internal. There's nothing on the outside that you can see that's happening. But within 24 hours, my temperature just soars, and I start feeling very feeling I've now learned that when I start if I notice I've got a hot arm, or if I notice I'm irritable, I take my sleeve off and find out where the redness is starting, because I know that it escalates very quickly for me. And I have not ever had anything but intravenous antibiotics as a response to that, because of the speed I think that it comes in at. So I noticed you mentioned in your speech, Richard, that pain is often one of the, and I don't know, Jean, did you feel pain?
I had aching. I wouldn't even call it pain. I would really call it aching. Yeah.
No, same here. So no pain, and the aching. But for me, it's the aching of having a fever. So aching is everywhere by that stage. So no pain really. It's really just the redness and you can see it just going from wherever it starts, and then it just spreads. And the very high temperature that I get straight away. So that's in terms of onset and identifying how I feel. They're probably the major signs for me that I need to get myself into emergency, and it is really always emergency. I think I tried the GP once, but basically I've been told, and I think Sharon's reiterated, just go straight to emergency.
We'll talk about I suppose your treatment options and who you should see in a little bit, but and obviously for everybody it's going to be different. Guidance is going to be different. A question for you there, Karen. So there's not usually an identifiable trigger or a cause. Is it? Do you think it might be sleeve causing the irritation of the skin?
I've actually come to the conclusion that it's actually a confluence of events, not usually one. It's I'm stressed. Okay. So if I look back in the weeks leading up to a cellulitis infection, I've usually been burning the midnight oil. I have I've been stressed. I've and that could be a whole range of things. I might have, I have BCCs that pop up. So it could be like a little BCC on that arm, because that has been the worst arm for that as well. It could be a scratch. Sometimes it has, I could look back in the last couple of days, I've been in the garden, for example, but nothing really obvious. But it just seems to be very much that I've been really, really busy leading up to it. And I might be careless as well. I might massage my arm less. I might, you know, hurt my arm where normally I would be a lot more careful. So that's for me, that seems to be the background to it.
Yeah, it's generally a combination of events where you may have a scratch and generally, but if you're a bit run down, your immune system perhaps a little bit lower, and then your body just doesn't manage to fight that bacteria at that point of time. So cool. Thank you very much, Karen. Ashlyn, are you there, and would you like to share with us?
Yep. So I've had lymphedema for 6 years. I actually think I left hospital after my breast cancer surgery with it. So I've had cellulitis 3 times, and I am very, very lucky in that my local GP, so I don't live in Adelaide, and my local GP, he's a Sri Lankan, he was a leading breast surgeon in Sri Lanka, but when he came to Australia, decided that he'd just be a GP. So he is all over the whole concept of breast cancer related stuff and cellulitis and all that sort of stuff. So my very first incidence of cellulitis was, it had been a really, really hot day, and we spent the whole day sitting in the water at the beach. And at the end of the day, got out, and the quick of my finger was a bit sore. And then a couple of hours later, it was red, but it was sorer than it should be for the amount of redness that was there. Like, it was really painful, like way more painful than it should have been. And it was like, okay, that's a bit weird. And in the back of my head thinking, well, Professor Pillar's talked all about cellulitis. Wonder if this is it. Went to bed, got up the next morning, my whole hand was red. It was like, right, straight to outpatients. Fortunately, it was my GP that was on call, and whacked straight onto antibiotics, some pretty strong ones, and had a couple of weeks of those and got rid of that. My second bout was a similar sort of thing. It was I had a little cut on my hand and on my lymphedema hand, and that I'm not wearing a sleeve on because I had an operation last month. I can talk about that too if you like. A lymphovenous anastosis or whatever it's called. But the second one was, again, a little cut. My third bout, I have no idea how I got it. I didn't have it, and I looked everywhere, looked in the mirror, everything, could not see it, like even when I knew I had it, still could not see any cuts or anything anywhere. I just had my hand and my arm was sore. And then when I took my sleeve off at the end of the day, it was red and splotchy. So I went, oh dear, this is not good. So the next morning, went off straight away to the hospital. And those photos of at the hospital, of course, it's always like 10:30 at night, isn't it? Oh, sorry, actually, no, I went that night, sorry, because that's right, because I took my sleeve off. I don't know if you can see that. Those photos are on the
You go back to your left a little bit, to your left, Karen.
On my left.
Yeah, and just tilt the camera and the top down a bit. That's it. It doesn't really come up. You just see the limb. It doesn't really show any colours or anything like that.
Oh, okay. Yeah. So those I did actually put, there was those photos are on the LASA website in some conversation about cellulitis. So and again, managed to get my GP, and our local hospital knows that if I call and say I've got cellulitis, I will be seen.
Yeah.
So I am lucky in that regard. So yeah.
So for each visit, you've gone straight to the hospital?
Straight to the hospital and on antibiotics within hours.
Yeah.
And a few weeks of antibiotics. And because I live where I do, like I said, I'm not in Adelaide, my GP actually has gives me a script of antibiotics to just keep on hand, because it's always on a Friday night when it, and it's a lot easier for them too if I can just pop a couple of antibiotics and then come and see them the next day rather than 2 o'clock in the morning or something.
Yeah.
So yeah.
Okay. Thank you, Ashlyn. I think at this point, just with the panel, if they've got any questions or comments or observations, just to add to what we've sort of shared, and at this point, if anyone got anything to add, Sharon, Jan, or Jennifer, you probably have to unmute yourself if you're already mute. That's all.
Thank you. Thanks, Jean, Karen and Ashlyn, for telling us so much really good information that each of you gave. I'm just kind of writing down some of the really good things that you said, because each of you had something to contribute to us in regards to, what cellulite is without getting clinical about it. And one of the things that I wanted to pick up on was the stress that I think it was Karen talked about as stress contributor. And this is all about your immune system. And one of the things that happens to your immune system when you're stressed is that it can't work as well as it normally does. Immune functions are suppressed while you're stressed. And so when you're busy, like you said, you might just be distracted and not noticing as well. But at the same time, your immune system also is being put on hold because your body thinks that there's more important things to do. So you've kind of given yourself a double whammy. You've already got a compromise in immune function because the lymph system isn't doing what it should be to help the immune system. So when you add stress, then that's very commonly can be a really strong contributing factor to things like infections. And it's something that people don't necessarily marry up, because they're looking for an event that they did or some way that they got a cut or something, and they don't recognize that stress can be that factor. So I really congratulate Karen for noticing that that's something that you can do to manage the way that your own onset.
Thank you, Jan. Sharon, do you have anything?
Yes, sorry, I dropped out for
That's all right.
2 minutes there. I'm not sure what Jan said, and I do apologise if I have a coughing fit, so I might have to break. But
That's okay.
I guess my comment was that it is fascinating. We've had 3 stories that are all very different onsets. But I think one of the important things to note is that just because you have redness in your arm doesn't mean that you've got cellulitis or your leg. And in fact, it's the BLS have put a document together, which is very interesting, and maybe people would like to have a bit of a look at it, but it's designed for clinicians. But it's been estimated that 40% of people are actually misdiagnosed with cellulitis. And that's a bit scary because it means then people go on antibiotics when they shouldn't, don't need to, and that's putting their body probably through an antibiotic therapy that's unnecessary, when really sometimes there are lots of different causes for redness. So I suppose that's one of my points, and that sometimes things be better managed with compression for a start if someone's not in compression. I know we'll talk about this in a minute, and antihistamines rather than antibiotics or steroid cream. So just don't be concerned if you've got redness. It doesn't necessarily mean that you've got cellulitis. The true cellulitis patient must have systemic changes, that is temperature changes or unwell. And if you've got redness in both legs or both arms, it's very unlikely that it's cellulitis.
Cool. Thank you. Sharon? Jan, do you have anything to add at this point?
Look, I think probably not regarding compression, but I think, which is what usually I'm talking about, but I thought a really encouraging theme from all of you, and thank you for sharing your stories, was that you sought help really quickly. And I think that's really important, to not just sit on it and watch it. And although Gina, you did actually say yours went on for a little while, didn't it?
Yeah, I'd never heard of it.
Yeah.
Yeah, I just didn't understand what was happening.
Yeah, but I think now it's really important to seek advice from either your medical professional or your lymphedema therapist, and do it quickly as well. Yeah.
Cool. Thank you, Jennifer. Okay, Deb, are there any sort of questions from the members that we could answer now that haven't been addressed?
I haven't got anything in the chat box yet.
Okay.
So nothing from me.
Okay. All right. Well, we'll continue on. For the members, is there any questions that you do have? You can either ask them a little bit later, or, like I said, put them in the chat box for Deb to go through as we go on. So we can definitely have a chance to answer some more questions later.
Sorry, Richard, can I just add something there?
Yes, of course you can.
Particularly with my last bout of cellulitis, when there was no cut or anything and it like completely threw me, what I did was also repeated when I went to the hospital by the doctor, was actually mark with a biro the edge of the redness.
Yep. And
just watch it for an hour or so, or a couple of hours or whatever. And that, because I had no cut for that last one, the redness spread, and then it got really, it was really hot to touch. Yep. So that for me was the clincher that, yes, it was about a cellulitis, despite there not being a cut. So just, if in doubt, put a ring, like if you've got any redness, put a ring around it with a biro.
Yeah.
That happens
to monitor.
Yeah. I think that's, and definitely combined with the heat and swelling, that sort of thing. So I'm just going to go back one slide, and the slide on the left, they've actually done that with the leg on that one. Sorry, I've gone too far. Sorry, we'll move. I hope. There we go. So the slide or the photo on the left, you can see they've put a ring or a marking around that where the redness has got to. So that just gives you an idea of if it's progressing. So that can be a good guide as well. Mm-hmm. Thank you. Thank you, Ashley. Okay, so if we don't have any questions just at this point, we'll sort of just go on a little bit further. Now, this is where we're going sort of into questions that we've had sent in to us, and we're just going to work through them, and I'll sort of ask either the panel or our guests to sort of answer those questions as well. So some of the questions are, what are some of the causes of cellulitis? Now, we mentioned a while back in one of the first slides, a scratch, dry skin, ulcers as well. What I would say, often it is through a break in the skin of some form. Anything else to add from either the panel or the guests? How it sort of, I suppose, may start?
Can I just talk about this, the little bit about the skin as a barrier? Yes. Because we are talking about things getting across, the things that cause cellulitis live on the skin naturally anyway. The problem is that they're getting across the skin and into the system. And that actually happens normally at a little slow trickle all the time anyway, but the lymph system takes it away and the immune system deals with it. So now we've got the picture where we've got the lymph system that can't work properly because it's been damaged or was improperly formed in the first place. And then we've got something that allows that bacteria to enter the skin more readily. And so the obvious thing is an entry point. But also if you've got lymphedema, and it tends to happen a little bit more for, say, breast or abdomen and legs, and you've got skin folds that have, where the skin is touching all the time, there'll be an increased level of fungus in those folds. Some of you might even notice sometimes that they can be a little bit smelly, a little bit sweet smelling because of the fungus that's in there. And your skin doesn't have to have a break for that extra fungus load to cause you a real problem. So really cleaning your skin folds and between your toes is really important. Don't wait for there to be, for the skin to get broken there. Really make sure that they're very clean. It's something that I think in a little bit in, you know, countries like Australia, we just take for granted that everybody is cleaning. But when you have lymphedema, you have to clean more specifically. You have to dry more specifically than people that are just like, you know, going about getting clean on a daily basis. So in terms of the causes of cellulitis, that's one of the best ways to prevent it, is actually to keep your skin meticulously clean, especially if it's folded in any locations.
Yeah, cool.
I think that's a very good point to make, Jan. I think toes and feet are particularly prone, and as we get older, it's really hard to get down to those areas. So, you know, we think that people with leg lymphedema, we know lymphedema is increases the risk of cellulitis anyway. So, but leg lymphedema perhaps has a slightly higher incidence, although some research would dispute that. But so going to see a podiatrist more regularly as you get older, very important, because we can't see things with our nails. The other thing I do with skin folds is I get someone to put a hairdryer on low and they can dry that. And it's quite an effective way of getting rid of all the moisture, especially if the skin is a little bit fragile and you don't want to rub it, or, you know, it's hard to get to. So that's a little tip as well, home tip.
Excellent.
Do you want to talk about the risk factors of cellulitis? Was that?
Yes, it's coming up in I think the next slide. Yes, we will come to that in a minute. That's anyone else anything to add for that first question? We've sort of covered the second. Well, Jan sort of covered that second, and Jane and Sharon have sort of covered that second question as well. So there doesn't always need to be that entry point or break of the skin for the cellulitis to enter the system.
And sorry,
That's right.
feel like I'm jumping in a lot. That's something that came up a couple of times in the stories that we've heard already too, that it wasn't recognised because, I've had this myself. I've turned up to the GP with cellulitis and I've been told it can't be cellulitis because there's no entry point. And again, with the overlying picture of lymphedema, if whoever is assessing that doesn't understand lymphedema, then they quite rightly will always be looking for an entry point with cellulitis, because that's really the typical cause. But when you've got the picture of lymphedema as well, and so people with lymphedema need to understand that there doesn't need to be an entry point for them. In their specific scenario, they can have cellulitis without an entry point. And so sometimes it's about you being the one that knows that and telling the doctor that, or trying to help the doctor to understand that you're an unusual case in that regard. And yeah, I thought when I was listening to Ashlyn, I was thinking how lucky you are, really lucky, or just whatever, that you're always working with a medical team who've actually got your history all the time, and that's not the case for a lot of people. They're going to clinics where they see different doctors all the time, and it's hard to keep that continuity. So sometimes you're the one that has to know to tell the doctor that because I have lymphedema, I can have cellulitis without an entry point.
Can I just add something?
Ashley, was that you?
Yes, it was. I have a statement and a question. So two things. First thing I want to say as a statement is we have to be our own advocate. No one's going to advocate for us if we don't. We need, you know, if you're concerned that it might be cellulitis, make sure that you are heard and that you're happy with the answer that you get. And yeah, that's my statement. My question is to all the professionals that we've got on tonight. So currently, I'm not sure if you can see, but I've got a sling on. I've got a broken shoulder that I'm waiting for surgery for. Is a broken bone, like it's not out of the skin's not broken, and it's my non-lymphedema arm, thankfully. I'm not sure if that's my good arm is the one that's now not the good arm. Is a broken bone, is that a risk of cellulitis?
Only because sorry, I can that a little bit. Only because there is, if there's significant swelling, there's probably a temporary risk of, you know, if that swelling is there for quite a while and it gets thick and then fibrosis sets in, that is a risk factor for cellulitis, just because you're not clearing out your normal lymphatic fluids, as Jan has already talked about. So that would be my comment.
But yeah, would that be a risk at the site, Sharon, or if it's on like the affected arm?
So sorry, broken arm, your unaffected lymphedema arm.
It's on the unaffected lymphedema arm.
Yeah.
Yeah.
Yes, it's the unaffected arm.
Yes. Yeah. So any swelling, when they've done a study coming out of the UK, any chronic swelling that's been there for longer than 3 months has an increased risk of cellulitis.
Okay, thank you. Okay.
Richard, can I hop in with just a couple of things that have come up? So just because they seem relevant to the discussion at the moment. So I've got one comment, which is that someone's had a red reaction response to a vaccination that was red, hot and locally swollen, but not cellulitis, as it did not progress and no systemic symptoms.
Yeah.
Somebody else has said in relation to cellulitis, how often is too often?
For bouts of cellulitis?
Yeah.
I'm going to talk about the vaccination one first.
Yep.
Was that a question perhaps around vaccinations?
No, it was just a comment to say that because we were talking about not all rashes are cellulitis.
Yeah.
So
well, interestingly, I have had a patient who's developed cellulitis after her vaccination, which was opposite arm. Now, we don't really know whether that was coincidental, but there was a study, it's only a case series, so there were 4 patients out of 8 in a rehab centre that all had lymphedema, and 4 out of those 8 that had vaccinations developed cellulitis, and 2 of those 4 had it for the first time. So that was, and then they were all immunised with the mRNA strain of the vaccination. So, you know, it's interesting. I think we will hear more about this as time goes on. Hopefully people are keeping statistics. I'm not an anti-vaxxer. I'm certainly saying don't get vaccinated. But what I am saying is I think be a bit vigilant about symptoms that don't feel right after vaccination.
Yeah, there's always that risk, I suppose. Yeah. Any other ones, Sharon? Sorry, Deb?
Well, how often is too often for cellulitis? Have our panel got any thoughts on that briefly?
Once is too often.
Yeah, and we just
Definitely
had
too often.
we just had a presentation at our therapist conference on how the infection damages the lymph vessels and doesn't allow them to work better. So we've already got a compromised lymph system, and every time you have an infection, it's going to compromise the lymph system some more. So you just want to not have them. And I know that's not possible for people to prevent them altogether, but I hope that people are going to find, you know, something in tonight's discussion to help at least reduce the number and help the new ones at least from ever getting it, because I think and this is just an observation, that there's an association between the more times that you get it, then the more times that you're going to get it. So you know, ideally you want to be in the state where you know enough about it to never get it in the, you know, the first time is the ideal scenario, of course.
There was a very interesting slide there, Jan, at our recent lymphedema conference in Hobart, and they showed a real-time video of lymph vessels pumping in a normal situation, in a normal limb, and then in the presence of an infection and inflammation, interestingly, and the pump rate went almost down to 0. So it was a very powerful image for therapists to see.
Any other ones, Deb, at this point?
Yeah, just a couple. One, I have lymphedema in my left arm. I'm due to have a knee replacement on my right leg. Will I be at risk of developing lymphedema in my right leg?
I don't believe so, unless the swelling, as I've pointed out before, is ongoing and not controlled after surgery.
And there's probably a lot of other risk factors that you should be looking at more than lymphedema in the arm, because it's like what's your vein health like, and what's your weight like, and what's your kidney and heart, all those things that are more about legs and swelling, than the association between having it in your arm. Those other things will be more of a risk factor for you than what's going on in your arm, I suspect.
Definitely.
And another one, which is a comment: knowledge is the best advocate as we lymphies can have. Sorry, knowledge is the best advocate we as lymphies can have. Education is a two-way path between client and health professionals, especially surgeons. So that's more of a comment. And that's all I got.
Okay, thank you. All right, so we'll just move on. We'll sort of just go to the next question. So who do I see if I think I'm developing cellulitis? So I suppose I'll just jump in here a little bit, and then we'll sort of, anyone else will comment. Perhaps your treating therapist, depending on, I suppose, the stage that you're at. It's just a rash stage, things like that. Perhaps check in with your therapist, but I wouldn't be waiting if you've got an appointment in 4 weeks' time. If your first symptoms and your therapist's appointment is very close together, you maybe just check with them or give them a call. GP, your doctor, clinic, or hospital would be your sort of your next steps, I would suggest. Anything from anyone else?
I would just say whoever can give you antibiotics the quickest is the person you should see first, because you can always follow up. Yeah, but was it Ashleen, did you say that you've got antibiotics on hand? And I think that that's a good conversation to have with your GP. Should you have some antibiotics on hand and have a good, with good instructions on when and only when you should take them, but is that something that should be considered more widely for people with lymphedema? I don't know, because I'm not in that kind of medical side of things, but I do know that a lot of clients that I had did have that arrangement with their GP, that they always had some up-to-date antibiotics at home, and they knew when to take them.
So Jan, I'll just add to that. So my instructions are very clear. I have the antibiotics on hand, but I take them as soon as I think it's cellulitis, as soon as I suspect, but then I need to go and see him the next day.
Yes. Yeah.
You don't just take the antibiotics and not check in with your GP.
No, that's correct. Yes.
Yeah.
Sometimes one cycle of antibiotics is not enough. It needs to be 2 or 3, especially with a first case.
Okay, thank you. Anyone else? Otherwise, we'll move on to our next questions. Now, as we've been talking, we have sort of covered some of the questions that will come up, but we will sort of address them again. But we've definitely sort of covered some of the areas that were with the questions wise. Am I at higher risk of developing cellulitis because I have lymphedema? you're up and on the screen, Sharon. Would you like to start?
Yes, absolutely. And there's been some really, really interesting research. And Jan, I could deflect to Jan if I'm not a researcher. So Jan is the researcher on the panel, so she may have more to add. But Macquarie Uni recently did a study in 2016, and they looked at 152 patients with cancer-related lymphedema, and they found that 7.7% of patients had a bout of cellulitis if they were in stage 1 or subclinical lymphedema. But if they went on to have more advanced lymphedema, then the statistics went up to about 30%. Now, there was another study that came out of the UK where they looked just at leg lymphedema. It wasn't cancer related. It was anyone who had edema for more than 3 months, I think it was. But it was a very, very large study. It was over 40 sites and 9 countries. So it was a lot of information came out of that study, and it was absolutely brilliant. I think they looked at over 7,000 patients with edema. And what they found was that 16% had a bout of cellulitis in the last 12 months, but there was a lifetime risk of about 38%. So we always used to think that cellulitis was more prevalent in legs, but those 2 studies tend to suggest that it's not that much different, somewhere between 30 maybe and 40% of people. But we do know out of all of that research that the risk factors were lymphedema and wounds are also more prevalent in people with lymphedema. So it's this continual cycle of wounds, lymphedema, cellulitis, wounds. And if you have cellulitis, you're more likely to get a wound. So there's this vicious cycle.
Oh, thank you. Sharon, anything else, Jan, or any of the guests?
If in doubt, get it checked.
Yeah. Thank you. Okay, so next question. Is everyone with lymphedema at risk? Sort of Sharon's sort of, I suppose, covered that a little bit with her statistics there, but I suppose the answer, absolutely right. Everybody is at risk of some form. I suppose some of the stuff we'll talk about tonight is, as we go along, is trying to reduce that risk.
Can I also add that one question I get is, are people with cancer-related lymphedema more likely to get cellulitis? And that is no, but you are more likely to get cellulitis if you have secondary lymphedema compared to having primary lymphedema, which I think sometimes isn't well known.
Thank you. Okay, any other observations, questions? Okay, we'll move on. Will I get cellulitis even if my lymphedema is well managed? Anyone want to jump in there? Well, I would say is there's always that risk, even though you do all your self-care, your management, your treatments with your therapist, there's always that risk. So as much as you can mitigate that risk, the better. And I know Jan is passionate about this sort of area. It's taking control as much as you can to reduce your risk. So Jan, sorry.
Yeah, and I think you've got to think here about the cellulitis really in terms of the skin, because lymphedema is something that's going on underneath your skin. At least initially the swelling's all underneath the skin, the fibrosis kind of underneath the skin, but all of that is affecting the integrity of the skin. And it's the integrity of the skin that is protecting you from the cellulitis in the first place. So, you know, really looking after the skin. And this is about finding a good moisturizing product so that you don't have little tiny, you know, dry skin has little tiny micro tears in it. That just advantages the bugs. You know, it's like we've got to make sure that the skin is kept in as good a possible condition. So there's the lymphedema, which people tend to think about in terms of the size of things, like how big is it getting. But when we're talking about cellulitis, the way to avoid cellulitis, whether your lymphedema is very small or very big, is to really, really look after your skin. And so unfortunately, there's no guarantee that you're still not going to get cellulitis, but certainly the better quality that you maintain with your skin, the less likelihood that you are going to have an infection.
And it's funny that's a really good point, Jan. Patients, another advantage of wearing a compression garment, and I know we'll hopefully talk a bit about the importance of compression, and I know Jen will have some good points to make, but the other thing I say to patients is that wearing your compression garment actually protects the integrity of your skin as well. So that's, I just think we don't think about that. Apart from the fact that it reduces your volume, reduces your fibrosis, which will already reduce your cellulitis risk, but it also can help protect your skin.
Yeah,
I'm so glad you said that, Sharon, because that is my absolute belief.
Yeah.
Good
I
on you.
honestly feel like this is my armor.
Yes.
And
Your
I
shield.
know I'm listening that you can get cellulitis without a scratch, but in my mind, this is my protection. And
Yeah.
I feel quite naked, you know, if I'm in the ocean or something without it.
Yeah, yeah.
Compression is a... Sorry, go on, Sharon. Okay, compression also is a really good way to prevent the changes that naturally happen in the skin with lymphedema, which is the skin gets thicker and then it gets papillomatosis and it gets those hard folds and things. And the right kind of, you know, good flat knit compression actually prevents those skin changes from, or at least slows them down from occurring in the skin. So, you know, the right kind of compression is just, it's
everything.
On so many levels. It's everything.
I'm
going to sound like a... Sorry, Jen.
No, I was going to say it might be a good time to pop in here. I know we're going to talk about compression, but you know, I guess what we do know is that compression does reduce the risk of cellulitis. So it doesn't mean that it's going to stop everybody from getting it, unfortunately, which is what, you know, has been your experiences. But we know it reduces that. And there was actually a really interesting study that came out of Canberra that Sharon and Jan and Richard, you may have seen, where they had two groups of people. I think it was about 180 people, and they put them in two groups. And one was it was for lower limb, and one group wore compression and the other group did not wear compression. Now, they didn't all necessarily have lymphedema, but they had edema in their limbs. And I think it was 15% of the compression group developed cellulitis, 40% in the non-compression group did. And the intention was to follow the groups for 3 years. They actually stopped the study before the 3-year mark because it was really apparent that compression was very effective. So that was not just in the lymphedema space, but that was reducing the risk of cellulitis.
Yeah, I think that's a really great study, Jen. And I think overall they came up with one of their outcome measures was that there was an overall risk of a 77% reduction of risk of getting cellulitis if you wore compression.
Wow.
So,
yeah, which is huge. Yeah.
Thank you, everyone.
Have a little bit of, I'm going to be called the statistic Nazi after this, but as therapists, we often find it frustrating when we talk about the importance of compression because nobody wants to wear compression. It's not a badge of honour. You know, it opens up conversations with people that you may not want to have. And, you know, if we could do without them, believe me, we would. But they did a study when they, you know, we realised that compression is very important for lots of different reasons. But they did a study in 2018 where they wanted to get patients' perspective on how they managed their cellulitis and to see whether patients felt the same way as therapists about compression. So 240 patients that were interviewed about what they do to manage their cellulitis. And out of all of those people, only 31% that they said that they were aware of any strategies to reduce the risk, which is worrying in itself. But out of that group, only a third of the people said that they would be willing to use daily compression to reduce the risk. Isn't that amazing?
Oh, yeah.
And yet 80% said that they would adopt better skincare at home. So very interesting. I don't know what we do to...
Yeah, that's a big question. How do you get around that?
Yeah, it's a tricky one.
Hesitation to wear the garments. I know the
And
dining
maybe
room.
part of that is, oh, sorry, Richard.
Oh, okay. Yeah.
I was going to say maybe part of that is people's history with garments, and I think, you know, in the audience here, you've probably all worn compression garments, and you've probably all worn ones that are comfortable, and then you've all worn ones that are uncomfortable. And I think for clinicians, the key is finding the garment that is effective, you know, that's doing what we want to do, and also that it's comfortable for you. And I think, you know, what fits you, or what fits you is not necessarily going to be the garment that fits someone else. And you in your, I don't like to use the word journey, but I guess in the sort of the path, you know, lymphedema changes as well. And so what works for you at one point may not be the garment that is actually the best garment for you at another point. So I think having that close relationship with a lymphedema therapist is really important, because they're the best people to advise you on that.
And again, I would just add, we have to advocate for ourselves.
Yeah.
In this sphere as well, in this conversation as well.
Yeah.
We are our best advocates. Yeah.
Yeah. I agree. And if something's not comfortable or not doing what you want, you know, I think speak up.
Definitely.
Being a 45-year-old with, you know, kids still at school, wearing a compression garment at the beach on school beach day, not much fun, but you know what? It's better than getting sick.
Excellent. Thank you. We'll move on if there's something.
Richard, can I duck in quickly?
Yeah, sure.
I've got one here that might be really interesting to ask the panel. What do you think of ICG mapping, such as Dr. Prasad at the QEH?
I wish every single one of my patients would have ICG mapping.
Can I speak to that, just having had the lymphovenous surgery? So I had the mapping. I had 3 goes at it. So the very first time I was mapped, I went in really excited, had the, you know, they're going to map my arm, blah, blah, blah. Squirted the dye in, went off for the couple of hours, came back, they did the scan thing, and nothing. My arm was completely dead. And it wasn't until that point that I didn't realise how much I was hanging my hopes on there being something there. But I was absolutely shattered. I just burst into tears and it was like, what, my arm's completely dead. Like there was nothing. I had 2 starbursts, one starburst in my wrist and one in my elbow. And so I was just absolutely shattered.
So Ashlyn, was that because you weren't, do you think you weren't, where did you have it? Was that at Royal Adelaide?
That was at the RA, yes.
Yeah.
Yep.
Do you think you weren't adequately prepared for the possibilities of what you would be seeing?
Yeah, I think that is true, yes. I didn't really know what, well, I went in thinking I was going to come out with all these, lines up my arm where, where it was mapped, and to be told that, there was nothing there, it was shattering. The doctor who did it, she said, lose weight, come back in 12 months. And I was absolutely shattered at that too. 3 other reasons, I've just lost 17 kilos. So I went back and decided that she said to lose weight. So, I have lost weight for another reason. I'll give the mapping another go. And this time around, there was, I had two vessels that were suitable for surgery, and like I say, a month ago I had the surgery, so it's worked. So yes, the mapping is good, and I would and again, advocate for yourself. It was only persistence that I went back and had the third scan, because the second scan wasn't much better. Sorry, so I had the first scan. She said, come back in 12 months. I did come back in 12 months. Again, the second one wasn't any good either. And then I lost all this weight. So then I went, well, you know what? I'm going to go back and have another scan and see how I go. And now I've had the scan and my hand, I'm not sure if you can see it, but that's actually my lymphedema hand. And you can maybe see the where the surgery cuts are. That, you know, I've got crinkles. That is so exciting for me to have crinkles. So yeah, there you go.
Thank you.
Crinkles are exciting.
Extremely.
Probably slightly off topic, but it's very interesting to talk about LVAs. That might be another webinar topic.
Okay. Yes. All right. So we will move on. So I suppose we've gone over this one. If I've had cellulitis once, there's an increased chance it will occur again. I would say generally a yes. There's always that increased risk. It's change in the skin condition, the lymphatic system as well. So yes, there's always that risk that it will occur again. Anyone add to that at all? Okay. What treatment options are? Sorry. Yeah.
Sorry, Richard. Just talking about. Oh, sorry. We might be getting to that with treatment options. I'll sit back.
Okay. What treatment options are available? Okay. I was going to sort of perhaps jump back a little bit here to our guests, Jean, Karen, and Ashlyn. What treatment options, I suppose, other than the antibiotics, which is I suppose your number one. Is there anything else that you guys have done or continue to do that treatment-wise?
For cellulitis or for
Yes.
lymphedema?
Yeah, really about the cellulitis. Yeah.
Laser therapy, massage, compression. I personally think consistent treatment is really important.
Yeah.
Working out, you know, how many weeks works for you, 6 weeks, 8 weeks, and just sticking to that schedule, you know, where you can. And to me, it just, my arm, after I recovered from the cellulitis, my arm was incredibly stable for years. I mean, my measurements just did not move. But as much as I don't love wearing compression, I understood immediately what it was doing, and I could just tell the difference in terms of the fluid moving, and the arm was less heavy. So I kind of just embraced it. You know, it was just something I was going to have to do, and I didn't look back after that. So, and then also for me, also exercise is the key to self-management. Whatever you like doing. For me, it's been Pilates, walking, but whatever you like doing, I don't think it even matters. It's just do it on a regular basis, even if it's a daily walk up and down the street. If that's what you start out with, great, because, you know, deep breathing and all that sort of thing, simple arm movements, 20 minutes when you get out of bed, something like that just makes all the difference to moving the fluid. And the only thing I've added recently is meditation. I mean, I've always meditated, but I've really gotten into a routine now before I go to sleep, where I do 30 minutes before I go to sleep. So that kind of, I feel like that's just bringing my body to a really deep state of relaxation. And no one interrupts me. It's, you know, it's not in the middle of the day where someone might walk in. So that's probably the only thing I've added recently.
Thank you. Karen, do you have anything to add?
Hi, and I realised my mute wasn't on, sorry.
Right.
There's been background noise.
No, we haven't had anything, it's been fine.
Oh, good. Me yelling at the kids, no. I suppose Jean looked at preventative treatment. In terms of treatment options for the cellulitis, though, I mean, I've only ever looked at antibiotics and IV antibiotics. I haven't even tried oral antibiotics at all. So there's a difference there. And I might actually be too scared to, because by the time it's that 24-hour period, and if I'm busy or looking elsewhere, I would miss it. But it might be something that I would look at. In 2018 and 2019, I had 5 cellulitis infections. But I know that I was very, very stressed during that period. And we had a 7-week family holiday in Europe lined up. And I was also very stressed about that, because I thought, well, you know, what if I'm stuck in France or Italy and I get a cellulitis infection? What am I going to do? And, you know, I have that 24-hour period. What else can I do? So the other thing in terms of prevention, well, it was prophylactic antibiotics. I took antibiotics low-dose antibiotics for 2 weeks prior to leaving. And this is after looking at a whole range of things, including having the operation. But I was doing so much that my lymphedema was actually really well controlled. In fact, in the lead up to that holiday, I think I had the skinniest arm I had for some time. And so we ended up, and because I had immunotherapy treatment for my melanoma, antibiotics are actually not something that my oncologist was particularly excited about. So I had to look at a whole range of other things, including gut treatment, for example, for my microbiome. We looked at a whole range of things in the lead up to the end of 2019 of ways that I might be able to deal with this to stop infections. The 7, 8, 9 weeks of low-dose antibiotics actually did the job. The holiday must have taken a lot of stress off, because I've only had an infection, I think, once a year since then. So I think stress is a huge issue, but I do wonder how much that period of low-dose antibiotics helped to hit it over the head as well.
Thank you. Ashlyn, do you have anything else?
Yeah, the first guest as speaker, she said about having massage and treatment.
Mm-hmm.
I was actually, with each of my 3 bouts of cellulitis, I've been told do not have massage, and also do not, because I use a lymphopress every night. Don't use that either during cellulitis, because you don't want to spread the infection through the rest of your body. So just stop all that. Yes, wear compression, but stop all the massage and pumping.
Yeah.
That was the advice I was given.
Well, thank you. That's actually some questions we've got coming up. So just if there's nothing else from anyone else, do we need to finish prescription of antibiotics? Absolutely. And can I use just this disinfectant? This is a question that we've had come in. Can I use disinfectant instead of antibiotics? Well, that's definitely a no for treating the cellulitis.
Can I just talk to that
Sure.
just quickly there, Roger? Sorry. Where it says, do I need to finish my prescription of antibiotics? One of the things to be careful of is actually making sure that you are on the right antibiotic, because many times over the years, I had clients who were not getting better. The cellulitis wasn't really getting better, and there was, just getting repeated and repeated prescriptions. And it turned out they weren't actually on the right antibiotic. So I think that, yes, definitely persist and take your course of antibiotic, but you should see that things are getting better. If you're on the right antibiotic, things should be improving while you're taking that course of antibiotics. And if they're not, don't hesitate to go back and say, am I actually on the right antibiotic? Is this the correct antibiotic for me? Because I have seen that be a problem and on a number of occasions. And also just in terms of disinfectant, and if they're meaning, can I drink disinfectant instead of antibiotics, then definitely not. But actually in podoconiosis, they use bleach to deal with some of the fungal infections. Now, we're talking about people who don't have access to antibiotics. We're talking about people who live, they're barefoot farmers in subsistence farmers. But it's not out of the question that you would use something to keep the bacterial load down on your skin. And what I do want to talk about here is the right pH of whatever skin cream you are using, because your natural bacteria on your skin love a pH of about, I think it's 4.5 to 5.5, something like that, slightly acidic. So it is worth looking at making sure that you've got the right pH balance in whatever skin cream that you're using. That also will help to keep the right kind of bacteria healthy.
Thank you,
Can I just say, so it's Karen here. Can I just say something about the disinfectant? One of the tricks that I found is, if I did notice, and that it's that the little skin things that happen on the side of your nail, for example, and it starts to get maybe a little bit infected because you've cut it or something like that. I flood it with
Antiseptic.
Yes.
well,
Absolutely.
betadine.
Or
Yeah, betadine.
alcohol.
Thank you.
Yeah.
Betadine. Yeah, or
Alcohol, if
alcohol.
you haven't got it,
Yeah.
yes. Just keep it clean. This is
Yes.
really important. Keep it clean.
Mm.
Cover it if you can. Very important to keep the entry. If you've got an entry wound, keep it clean.
So that's any sort of scratch, bite,
Mm.
that sort of thing, insect bite, split skin, that sort of thing. Very important to use your antiseptics, on that area to try and reduce that risk of the bacteria entering. Thank you.
Comment about Richard about the long-term antibiotics as well, and antibiotics are just the most wonderful invention, aren't they? But we can't rely on long-term antibiotics for all people to prevent breakouts of bouts of cellulitis. So they have found that if someone's had 3 or more bouts of cellulitis in 12 months and their swelling is uncontrolled and their BMI is more than 33, so that they are obese, that weight management is a problem, then it's very unlikely that those antibiotics are going to be able to prevent the breakout bouts. So I think, again, it goes back to Ashlyn's, comment about taking ownership and taking charge of your health, and you can't just rely on other people always, just to maybe do the hard work for you. In this case, the antibiotics, is that we are also responsible for doing things for ourselves.
Thank you.
Richard, can I add to both of those questions? So about finishing the antibiotics, I've always been told that, yes, you have to finish them, but also after 3 days, you should notice some kind of change.
Yeah, an improvement.
Whether it's how you're actually feeling yourself, or the heat goes out of it a bit, or the redness is, like, you should see some change in 3 days. I'm not a doctor or anything, but that's what I've been told repeatedly. So, and also about the disinfectant, I in my handbag have my lymphedema emergency kit, which consists of betadine, disposable gloves, and Band-Aids. And I do not go anywhere without those, because if you're out somewhere, as soon as, if I get a little paper cut or anything, douse it in betadine, wrap the Band-Aid around it, and by doing that instantly, like I say, like over, I'm 6 years into this journey, and I've had 3 bouts. So, yeah, there you go.
Yeah, again, it's been proactive in reducing that risk as much as you can. So that's it. Thank you for that. All right, so we'll just move on. The next lot of questions, we covered a little bit there with, I think it was Ashlyn, you mentioned this, or it might have been Karen. I'm sorry if I got you mixed up there. So, do I wear a compression garment if I think I'm developing or have cellulitis? Should I have lymphatic massage, drainage massage if I'm developing or have cellulitis? And should I continue with my self-massage if I have cellulitis or think I'm developing cellulitis. Anyone want to sort of add to the little bit we had before?
I do want to go back to something that Sharon said about not all kind of warm red skin is cellulitis. Not everything is a cellulitis infection. And so a lot of these questions about, you know, whether or not you're going to have a lymph drainage treatment or whether you're going to do your self-massage really depend on understanding whether you do actually have an infection, in which case you don't want to really do too much lymphatic stimulating stuff, because your body will be trying to isolate it in place and not let it spread too much. So you don't want to give too much opportunity for the infection to spread. But on the other hand, if you don't have a cellulitis infection yet, but you have a high bacterial load under the skin, it makes the skin nice and rosy and warm. Actually doing a lot more stimulating, lymphatic stimulating stuff like the exercise, like the self-massage, like seeing a lymph drainage therapist, that actually might help your system to cope with that higher bacterial load and prevent cellulitis from forming. So this is, I'm sorry, one of those very ambiguous answers where, you know, you really are going to have to pay attention to whether your symptoms are something that is actually an infection or not. And so I want to go back to what Sharon said about that diagnostic criteria of having the systemic. If it's making you feel bad, it's probably cellulitis. If it's not making you feel bad, it might not be cellulitis yet. Have I got that right, Sharon?
Yeah, absolutely. And I do suggest if people, you know, I think every GP should have it in their clinic, but this is the red legs pathway. You probably can't see it there, but if you go to the British Lymphology Society website, anyone can access that. And it's really, I think it's very useful to look at those things as a clinician and as a patient to help you determine, you know, where to go, what to do, what is the next step.
I just want to add, when I said when I got cellulitis that I was on an antibiotic for 16 weeks, I saw the GP every single week. So he was certainly not willing to put me on an antibiotic and then say, you know, figure it out yourself. I mean, as well as sending me to see you, Sharon, in your clinic, he also monitored how I was dealing with the infection. And when he tried to remove the antibiotic, how I went the following week. So I don't think antibiotics are anything to fool around with. Even oral antibiotics. That's strong medication, and yeah, I think you have to be monitored. You've got to have a good PT.
And just on the flip side, you don't want to be on antibiotics if you don't have to be.
Absolutely. I've never, before that, I can remember taking an antibiotic 2 or 3 times in my entire life, probably. And since that cellulitis, which is now, I don't know, 7 or 8 years ago, I've never taken one since.
No. Interesting.
Sharon, could you put that document up on the LASA website?
We can. Yeah, we'll look that up. We'll put it up for you. I've taken a note for that one. So yes, we'll track it down. Any other questions there? Last couple of slides coming up. So next one, I'm going to sort of just jump through to, should I exercise if I have cellulitis? When can I start exercising after cellulitis? What type of exercises are safe or beneficial for cellulitis? So I'm sort of jump in here a little bit. So generally speaking, if you do have cellulitis, again, it's a yes or no question. But generally, if you're feeling unwell, you're best to be resting while you have cellulitis. Then you can still obviously do your daily activities if you're well enough, but you shouldn't be doing extra activities. It's when you can start is probably when you're feeling well, or you get clearance from your doctor, GP, whoever's treating at that point. What type of exercise is safe or beneficial for cellulitis? There's no specific exercises that will help with cellulitis. Your exercises will be sort of, I suppose, that we look at focusing on is managing your lymphedema as much as possible, which we've touched on a bit before, is really making sure you're doing as much exercise as you practically can for helping to reduce or improve your lymphedema. So getting that muscle pump happening and things like that, and weight reduction if excess weight is a factor with you. It's really looking at whatever exercises you can do, and I always advocate exercises that you enjoy or hate the least if you don't like exercising. So it's got to be something that you're going to do, not something you're going to dread every time you think about it. It has to be something that you can enjoy or at least tolerate doing. But it's really important to do some forms of exercise. Anything else from anyone on that one?
No, I think that's good, Richard. I think finding something you like to do is absolutely critical. And I mean, it doesn't matter. Jean, I think, mentioned some different exercises. It actually doesn't matter what you do. In fact, even if you are, I know, dependent positioning and being in a wheelchair or chair bound is actually a risk factor for getting cellulitis. But even people that are sitting can generally do pedaling, stationary pedals or elastic bands and get their calf going, or marching on the spot, or it's just that lack of movement and that dependent positioning, particularly for legs.
Anyone else? That's all. Okay. Just the last couple. Get some movement happening here. Self-care options. What self-care options can reduce the risk of getting cellulitis? So really, again, it's really going back to you're managing your lymphedema as much as you can. So what can you do? It's your exercise, your garments, your skincare, self-massage, treating, manual lymphatic massage, laser treatments, whatever combination works for you, and obviously access to those services if you're not sort of within Adelaide or city centres, that sort of thing. It's really looking at what you can do, and it's not relying again on just your practitioner to do that manual lymphatic massage or making sure you've got the right garment. It's got to be combining with your self-massage, your skincare, exercising as much as you can. Anything from anyone else? Perhaps if nothing from our panel, our guests, sort of, I know, Jean, you've sort of expressed your I suppose, regime that you do, but anything else the other ladies do with their...
I would add that I had a reoccurrence of breast cancer November 2020. And so last year I had 5 surgeries and 4 months of chemo. And I thought, well, I'm never going to get to the lymphedema clinic for treatment. There's just too much going on. And so I'm really going to have to just rely on myself. And my oncologist said to me, you know, even on the worst days with chemo, 6 minutes of cardio a day, even if you just walk up a hill, that's all I'm asking from you. So I did take it to heart, and I have to say my arm was remarkably stable through all of last year. And that was really just me and doing whatever exercise I felt I could do in between the treatments. And really, I don't think my measurements changed, or I was quite pleased that, you know, it all stayed relatively stable, because it was something I didn't really want to have to think about with everything else going on. So yeah,
I think that's such an empowering thing to be able to tell people, Jean. I think that, you know, you do, you know, I think Ashlyn said we're the masters of our own destiny in some ways.
Yes.
Put in so much hard work to get your arm stable.
Yes.
Key. It is well-managed lymphedema is going to be the most important thing in reducing your cellulitis risk. And that will include massage, whatever you do, absolute, you know, for sure. But getting it under control probably reduced your risk when you were then at risk again.
Yeah, absolutely. I mean, you have to prioritize in your life. We all have dramas. And I sort of recognized from the beginning of last year that lymphedema was going to have to go on the back burner. It was just going to have to be something I managed myself. And yeah, and as I said, I was so lucky. I have a good breast surgeon and an oncologist who said, walk, like whatever you feel like you can do it. And I did. So, and I think that's really what kept the lymphedema quite stable during, you know, a challenging year.
You do? Anything else?
So,
Sorry. Yeah.
so Richard, my process is before I put my feet on the floor, I have a series of massage and breathing exercises I do before I even get out of the bed. Get up, shower, straight into the sleeve. Do my daily, you know, day stuff. And then the last hour of the night is spent sitting, well, normally on a pump.
Yep.
So yeah, pumping for an hour. And I go to Adelaide once a month for professional laser and massage treatment.
Yep.
And am in a sleeve 24/7.
Yeah, thank you. Again, it's taking that control and doing what you can to help with your situation as much as possible.
I was going to add, like, I'm sorry, names just gone out of my head. I too am in a sleeve 24/7. I found that the nighttime sleeve was really, really helpful, and I actually use it when I'm having a bout of cellulitis as well. I just feel that it helps and keep the swelling down whilst it's being treated, and it does seem to help. Certainly when I was introduced to that night sleeve, I felt I had far more control of my lymphedema. I also, when I get up, I do my massage in the shower, and that is, even if I am running late, that extra 5 minutes in the shower having my massage, I notice a difference when I don't do it. And those are the sorts of things I think that lead to cellulitis, is if you're not doing that self-care and you're not keeping things under control. So nighttime, nighttime sleeve, and first thing in the morning, having that shower, and also wearing my daytime sleeve all day. When I fly, I add my sleeve, my glove for my hand as well. All of those things to just keep control of the lymphedema, and yes, exercise, but also the exercises specifically for the arms. So the pumping, of you using the pump or the just hand pumping, and keeping that under control as well. That's something I do daily.
Yeah, that's sort of your decongestive exercise or specific lymphedema exercises, which most therapists, lymphedema therapists, should be able to supply you with I suppose a routine or a sequence, which is the best for that. So it's not something you already have. It's definitely worth asking your therapist to assist with that. There's plenty within the Adelaide community that know enough about decongestive exercise and that sort of thing. And we do like to share, don't we, Sharon, information around.
Absolutely.
So, we do work quite closely together within the community. We don't sort of go, oh, you're my client. So we're happy to provide assistance and as much help as we can. So we're plenty of help out there. I'm just going to ask around and ask us. Anything else?
Just
from
ask,
anyone?
yeah, I think one of the questions, Richard, which I'm not sure that we actually answered, maybe Jen's online too, she might want to talk about compression, but
Yep.
one of the questions was whether to wear my compression garment when I have cellulitis.
Yep.
And
Definitely was a question, yes.
yeah, I'm not sure if we answered it or not, but my personal thought is we should still be wearing compression during a bout of cellulitis, absolutely. I know I've heard some GPs say, oh God, take that compression garment off right now. You shouldn't be having it if you've got cellulitis. Well, that's actually counterintuitive. It's not right, because we need to control that swelling to prevent. And I think the people who are wearing compression would say that their arm feels actually a lot better when you've got your compression on. But I did want to comment that sometimes if the swelling does get worse, and it can get quite a lot worse with cellulitis, is that your compression garment may not fit properly. So go and see your therapist and talk about that. And it might be that you might need to go into something else temporarily. And I think Karen very rightly talked about the night garments, which are generally a little bit more generous and stretchy, and so they are sometimes the better things to use during the day, or wraps, or I've even put someone in a tubey grip just out of desperation, just temporarily. But compression is important. In fact, the Netherlands, as soon as someone is diagnosed with cellulitis, they sometimes increase their compression. So yeah, just that's my final comment.
I can talk
Interesting,
to my
Sharon.
experience on that, Sharon.
Yeah.
Sorry.
You turn, Ashlyn.
Okay. So with mine, I was told to keep wearing my compression, and like you said, Sharon, that at one of my bouts, the sleeve got actually too tight. So what I did was used an older sleeve, like, because I always keep like the older ones that are overstretched a bit for gardening and stuff, to put over the top of my existing ones. So I wore an older one that was sort of a bit overstretched when it got too tight. But the other thing I would also say is that because my first bout, I wore my compression sleeve and sort of did my usual, leave it on for the day and take it off at night to put the night sleeve on. But the second and third one, I consciously made the decision of taking my sleeve off several times during the day, so about 4 times during the day, just to monitor my arm, like for the redness, and to actually feel it, because if you've got a sleeve on, obviously you can't see has the redness increased, and is it hot or not. So I actually made a point of 4 times a day taking it off so that I could actually make that visual inspection.
Oh, thank
Great
you.
idea.
Yeah. Jennifer, you had something to add for us?
I think I was going to say everything that Ashlyn just said, actually. So no, that was perfect, because I think, it is a bit counterintuitive, because it's like, we've got to get compression off, but yet we know that when you have an infection, you will swell and there will be more edema, and we know that contributes to the cellulitis. So it's this sort of, it's this cycle, isn't it? So I think if you can tolerate the compression, wear it. If you can't tolerate your current garment, if you have an old garment that is obviously still able to do the job and it's clean. A lot of people these days might have a wrap as well, which is easier. A bit like Sharon said with the night garment, a wrap is easier if you've got one in your kit. You can adjust it, but I think understanding that compression we need to manage the edema as part of the healing process.
Thank you. Anything else? Deb, do you have any questions from our guests? Or
we've kept on top of them pretty well, except for there is one that came up again after about the ICG. Is there a cost to the mapping? Should it be subsidised? Lymphedema is an expensive condition to have. So everybody's thoughts on that, maybe, especially those that have had it done. Was there a cost involved?
So I had mine done at the RA, And no, being a public hospital is no, it's completely free.
Oh, wow. Okay.
You just have to have a referral from a GP to the plastics clinic, Dr. Roy.
Yep. Interesting.
Ashlyn, can I ask you a question about that? Was your because actually this actually came up today with a therapist and a patient, and she was asking, did you need a referral with a view to surgery, or were you able to have a no?
No, it doesn't have to be a view to surgery. No. Okay. Not at all.
All right. Okay.
No.
Thanks.
And I did actually ask her, am I allowed to say your name? And she said yes. But she also did say, so Dr. Jenny Roy, so she's works out of the RA, but she was finding that she can't get enough time in the RA. So she is actually practicing privately as well at the moment, or now. So I'm not sure how, so a certain amount of days a week she's practicing in a private clinic. And if maybe Deb, I could share those contact details with you if you like.
Yep, definitely.
So that's private or public through the RA. Obviously, if you go through the RA, it's a waiting list. I think I had to wait. It was about 6 months for my initial visit, and then once we got through like the third lot of mapping, and it was, yes, you can have the surgery. It was I think 7 month wait, but you know, when you're 6 years in, who cares?
There's another surgeon, plastic surgeon, Dr. Barney Prasad, works at the Queen Elizabeth Hospital Specialist Medical Centre, and he also sees people privately.
Okay, thank you. If there's any, I suppose, any questions from our members, either type in your, Deb, if you're able to open up the mute button if anybody wants to ask any questions.
Yeah, people should be able to unmute themselves, I think.
Okay. Anybody wants to ask any questions or comments on anything that we've gone through? If any, obviously the panel have got anything else to add before we sort of look at finishing up. There is a range of resources. But if this is going on our our YouTube channel, is it?
It will. It will. I'll edit out our beginning chitter chatter and our screen sharing dramas.
Yeah.
All of that will go. But yep.
Yeah. So I've got a range of resources on there as well, which we'll sort of leave on, and you can have a look through as well.
Yeah.
If there's any other questions at all from anyone? Don't be shy. Okay, if there's nothing else, I'll just a big thank you to the panel and our guests, and obviously all our members for coming along and listening in. If there is any questions you have down the track, obviously just get in touch with us at LASA, and we'll sort of help you out as best we can. There's just possibly a couple of chats coming in, but there's nothing else, ladies and gentlemen. We'll sort of finish up at best, but very big thank you to all our panel and guests for contributing your time tonight. It's very much appreciated.
And thank you to LASA for organising it.
Pleasure.
Yes, thank you.
Nothing else? Okay. Thank you very much, ladies and gents. We'll
Okay.
bid you farewell. Thank you.
Thank you.
Good night.
Night.